Hello everyone, today we'll be looking at REMS of the elbow. So REMS stands for Regional Examination of the Musculoskeletal System, and today we'll be looking at the elbow region. So REMS of the elbow, like any other REMS, you're going to do in a sequence of look, feel, move, and functional tests. So first look, ask the patient to stand in anatomical position, that's standing straight with legs shoulder width and hands facing forwards. So palms facing forwards. So from this position, you can inspect from the front, from the side, and from the back. Some of the things that you can see from the front is the carrying angle. So uh, in normal people, there's a carrying. Your hands will actually bend outwards a little bit. That's called the carrying angle. In men, it's about 5 to 10 degrees, and in women, it's about 10 to 15 degrees. This is because women has bigger hips. So when you're swinging your arms when walking, you wanna avoid hitting the hips. So that's where the carrying angle comes in. And then inspect from the side. Some of the things you can see is flexion deformity of the elbow. And from the back, you can see rheumatoid nodules or psoriatic plaques, or any swelling such as olecranon bursitis or student's elbow. Right, so look from front, look from side, and look from the back. Next, you're gonna feel. You're gonna sit the patient down first, and then you're gonna feel for temperature, comparing the forearm and the elbow. Usually the elbow shouldn't be hot, but if there's inflammation going on, it might be hot to touch. Right, and then after that, you're gonna feel the elbow area. So first, you're gonna hold the patient's forearm. So if you are testing the patient's left arm, you're gonna hold it with your left hand, and if you are testing the patient's right elbow, you're gonna hold his right forearm with your right hand. Right. So left with left, right with right, and then the other hand, you're gonna feel for their elbow, and at this time their elbow is bent to 90 degrees. Right, so you're gonna feel their elbow with the other hand. You're gonna feel first the radial head, then the joint lines, then the medial and lateral epicondyles, and then the olecranon process. Okay, all of this is to feel whether there's any tenderness. Tenderness means there's pain on palpation, so you have to observe their face to see if there's any grimace while you're pressing on these areas. So radial head, joint lines, medial and lateral epicondyles will be tender in cases such as golfer's elbow or tennis elbow. So for golfer's elbow, the medial epicondyle will be tender, and tennis elbow, lateral epicondyles will be tender. Right, and then when you're palpating for the olecranon process, you might able to feel for olecranon bursitis, which is a student's elbow, so you can feel some fluctuating fluids. Right, that's what bursitis is. Inflammation of the bursa. Right. After that, move. You're gonna check for flexion and extension of the elbow joint, both actively and passively. Actively meaning the patient does it themselves, and passively meaning the patient is relaxing, and then you're gonna move it for them. So flexion, extension, supination, and pronation of the hand. And then lastly, we're gonna go to functional tests. You're gonna ask the patient to put their hand to their mouth. This is because this is testing the function of one of the ADLs, which is eating. So you want to test if the patient can eat independently. You want to test if they can move their elbow to the level of their mouth, so that their hand can reach their mouth. Yeah, and if not done, not already done, you're gonna ask the patient to put their hands behind their head. Usually you do this in GALS, which is gait, arm, legs, spine, which is the screening examination for musculoskeletal systems. You're gonna ask them to put their hands behind their head. This is to test if they can do some things such as personal hygiene, like combing their hair. Yeah, and that's all I have for you. Thank you.